Hi, my name is Neil Appana. I'm a specialist gynecologist in Hamilton in New Zealand. Welcome to my series of educational videos in gynecology. Today we're going to talk about colposcopies. You will have been referred in to me because of having an abnormal smear. So what does an abnormal smear mean? A cervical smear is done to detect early changes in the cervix, which if left untreated may go on to form cancer. These changes are precancerous, and treatment and good follow-up almost always prevents the development of cancer of the cervix. If you have a scale with normal on one end of the scale and cancer on the other end, there are a number of changes through which the cervix goes through before it becomes cancer. The mildest form of change is called HPV, then SIN1, which are low-grade changes, SIN2 and 3, which are higher-grade changes, and some specialists add a category of SIN3 with glandular extension as well. Everything to the left of the line is precancerous and therefore totally curable. Your smear may also show atypical cells, which may mean an abnormality, an infection, or just a reaction to inflammation, or may mean that there is no abnormality. The smear report will usually say whether it favors an abnormality or not. So what does the cervix look like? The cervix is the neck of the womb. It is usually about 3 to 4 centimeters in length. It is the entrance to the womb. The outside of the cervix, called the ectocervix, is formed by thicker skin, called stratified squamous epithelium, similar to skin elsewhere in the body. The lining of the tube, or endocervix, is formed by thin columnar epithelium, which is almost transparent and looks like a grass burn, and because of this can appear quite red. The junction between the two areas is where any abnormality takes place and is called the transformation zone or squamocolumnar junction. So just what changes can be detected on smears? Inflammation or infection. This is common, especially in women on the oral contraceptive pill. The inner lining of the cervix becomes exposed to the acid environment in the vagina, making it appear inflamed. This may also lead to an increase in mucus secretions, giving one a discharge, which is usually not offensive. If the discharge becomes smelly or discolored, infection may have intervened. This may be associated with the use of tampons, which dry out the vagina, making it more susceptible to infection. Atypical cells. The cytologist reports this when the cells do not look quite normal, but he is unable to say whether there is in fact any abnormality on the smear. He will report this as favoring dysplasia or of unknown significance. If the smear favors dysplasia, you will be referred in to see me. If it is uncertain, you will be asked to have your smear repeated in 6 months. If it is still atypical at this stage, then you will have been referred in to see me. Guidelines recommend that you are seen within 6 months for this. HPV, or the human papillomavirus, or the wart virus. There are hundreds of different strains of the wart virus, and more are being discovered all the time. Some specific strains of this virus are associated with changes in the cervix. Many women have HPV infection at some stages in their lives. 2 out of 3 people that you know in New Zealand will have had HPV at some stage. This usually disappears spontaneously. We are unsure what triggers HPV to actually infect the cervix. If you have HPV, you will therefore require to have smears more frequently. Low-grade changes. These are mild changes in the cervix. They are also referred to as mild dysplasia and SIN1. The smear is usually repeated in 4 to 6 months. Sometimes this change disappears spontaneously. If it persists, you will have been referred in to see me. Guidelines recommend that you should be seen within 6 months for this. High-grade changes. These are more serious changes on the cervix, but are still not cancer. They have been referred to as severe dysplasia, SIN2, SIN3, SIN3 with glandular extension, or CIS, which is carcinoma in situ. If you have any of these changes, you will be referred in to me. Guidelines recommend that you should be seen within 1 month for this. Suspicion of invasive disease. This is a very serious abnormality and may mean you have cancer. Guidelines recommend that you should be seen within 1 week for this. Most abnormalities on smears are abnormalities of the ectocervix, which are stratified squamous cell abnormalities. Occasionally, the smears may show agus, which are atypical glandular cells of uncertain significance, or ASIS, which is adenocarcinoma in situ of the cervix. These are abnormalities arising from the endocervical cells, or the lining of the uterus. Another abnormality occasionally commented on are endometrial cells seen on a smear in postmenopausal women. This is normal in women who are still having periods. This will usually require an ultrasound scan and some form of sampling of the lining of the uterus. What happens at my rooms? Because of the abnormal smears, you will have been referred into me for a colposcopy. A smear is just a superficial scraping of cells, which is great for screening, but does not give us an absolute diagnosis. A colposcopy is a procedure during which the cervix is examined using a microscope. I also use different dyes and stains, which help me to determine exactly what the abnormality is. The procedure takes between 10 and 15 minutes. Usually a smear is taken and punch biopsies are taken. Punch biopsies are little pinches of tissue which are then sent off to the laboratory. Following a punch biopsy, it is usual for a small blob of blood to form over the area. I apply a stick of silver nitrate to the area, which usually clots the blood and stops the bleeding. Occasionally, the bleeding may be heavier, and pressure may need to be applied. This can cause some discomfort. Sometimes, even with pressure, the bleeding does not settle, and a special fluid called Monsell solution may be applied, which forms a scab over the area. Very rarely, a suture is required. This will usually give us a more accurate diagnosis and help to determine if any treatment is necessary. The result usually takes about 7 to 10 days. However, can take just 48 hours if we are really concerned. The area that needs to be seen is called the transformation zone, or the squamocolumnar junction. This is where the thicker outside layer meets the thinner internal layer of the cervix. Occasionally, this layer may be higher up in the cervix and not be easily visible. This is especially so in postmenopausal women. We do have instruments that stretch the cervix to make it possible to view the area, but occasionally this may not be possible even with these instruments, and you will be put onto an estrogen cream and have the colposcopy repeated in 2 to 3 months. So what am I looking for at colposcopy? Firstly, I check the surface contour of the cervix. Secondly, I check the blood vessel pattern. Thirdly, we use a vinegar-like solution. This turns abnormal cells a whitish color. We then use an iodine-type solution. This is taken up by normal cells and makes them appear dark brown. I also check the margins of any abnormality. At the end of this procedure, punch biopsies will be taken. I will let you know what my thoughts are, and more than 9 times out of 10, the results come back confirming what I have suggested. So what happens following a colposcopy? Because of the punch biopsy, you may have slight bleeding or a discharge for a few days afterwards. You may notice a scab come away. You should not have intercourse, use a tampon, or use a spa or a swimming pool until the bleeding or discharge has settled, as this may predispose to infection or bleeding. If the bleeding is more than a period, or the discharge becomes offensive, you may have an infection and you should contact me. You will usually be contacted by a nurse when your results are back and asked to return to discuss them. We usually do not give results out over the phone, and if you do request your results over the phone, they will be unable to do more than just give you the results. They are not able to discuss the management of these results with you over the phone. Will you require treatment? This is totally dependent on your results. Some abnormal cells will clear up completely without treatment. If treatment is necessary, it will depend on what the abnormality is, the size of the abnormality, where it appears on the cervix, and also your fertility wishes. I will discuss these options with you in some depth. How will treatment be done? I will usually recommend whether the treatment is done under local or general anesthetic, depending on how well you have coped with the colposcopy. Almost 75% of treatment is done in my rooms under local anesthetic. If the treatment is done under local anesthetic, it can be scheduled for any day. General anesthetic procedures are scheduled for the local hospital on either a Monday or a Tuesday. What are the treatment options? A SEMS coagulation. This treatment is for milder changes and involves a probe which is heated up to about 120 degrees Celsius. This is applied to the abnormal areas, destroying these areas. Other clinics also use cryotherapy, that is freezing, for the same effect. A Let's loop. LET stands for large loop excision of the transformation zone. This removes the abnormal areas using an instrument designed specifically for this purpose. Loops come in different sizes and shapes, which are decided on dependent on the lesion. Others use laser for the same purpose. Some types of laser treatment evaporate the abnormal area. Hence, no specimen is sent for histology. I prefer to have the specimen reviewed to make sure that everything is excised completely. A cold knife cone biopsy. This is a biopsy that is generally done under a general anesthetic in hospital and involves using a scalpel. What happens following treatment? You will usually be placed on antibiotics. These are taken for between 2 to 3 weeks after the surgery. With the semin's coagulation, a watery blood-stained discharge is common and may last for up to 4 weeks after the procedure. With Let's loop and cold knife cone biopsy, a small amount of bleeding is common. This should not be heavier than a normal period. You should not have intercourse, use a tampon, or use a spa, swimming pool, or have baths until the bleeding or discharge has settled, as this may predispose to infection or bleeding. If the bleeding is more than a period, or the discharge becomes offensive, you may have an infection and you should contact me. Very occasionally, for some unknown reason, some people develop what's called secondary bleeding. This can happen anywhere between 7 to 14 days after surgery, and occasionally even later. If there is heavy bleeding, you should contact me immediately for this. You will usually be reviewed 2 to 3 weeks after surgery, and the cervix will be viewed. Occasionally, antibiotics may be continued for a further period after this examination. Long-term follow-up is planned at this visit. You are usually reviewed for repeat smear colposcopy in 4 to 6 months, depending on the results. Generally, I will follow you up for 2 years before discharging you back to your doctor. The chances of recurrence are usually highest in the first 2 years after treatment. With this regime, you are unlikely to develop cancer of the cervix, no matter what stage of cancer you previously had. Disclaimer. Without having examined you personally, it is impossible for me to make a diagnosis or advise treatment. All information provided here is generalized and for educational purposes only, and decisions based on this should not be made without consulting your own medical professional. I assume no responsibility for you taking advice rendered here without me having had a physical consultation with you.